Hey, I just wanted to come back on and talk about my 33rd week of pregnancy. Today I started my 33rd week, and today I also had my GI doctor, so that was kind of an interesting experience. First, I wanted to touch on some of my pregnancy symptoms that I've been dealing with, and then I also wanted to kind of go into some of the more embarrassing or funny pregnancy symptoms that I've experienced this pregnancy. Right now, I have been having a lot of contractions still, some Braxton Hicks, and then some of them I notice are really painful. So I don't know if that's normal for Braxton Hicks or if it's just, I don't know, actual contractions. Who knows? But they're not at regular intervals, so that's good. So really, really out of breath. She is not head down, and she is way up into my rib cage, and she's just laying so weird. So she is constantly just jammed up into my rib cage, and I can't breathe. When I clean, I have to take a ton of breaks. It's hard for me to walk through the store. I feel like I'm gonna pass out. I have a toddler, and he would turn 2 in January, and he still nurses. So I noticed he's been picking up on nursing. I don't know if he can tell that the baby's coming and he's just kind of regressing and wanting to nurse more, but it is very painful. Not only do I keep getting contractions when I nurse him, but it also is just painful on my breast to nurse a toddler, especially when he uses his teeth. And it's already very tender from being pregnant. So that is not fun. I've had to tell him quite a few times that no, Mom, he just can't nurse you right now. We can cuddle, but Mom, you cannot breastfeed. Having a lot of pain in my back. I'm thinking it's like a sciatic nerve pain. It'll shoot down my leg. It'll make my toes numb. It makes it hard to walk. I think she's just sitting on a nerve weird. I'm pretty sure that I felt the same thing when I was pregnant with my son too. He was always sitting weird, and then I would get a sharp pain, and then it would go down my leg, and then I would just, when I was walking, it just kind of stopped me in my tracks, or I'd almost fall over. So I think that's just common, and it's just because the baby's getting big, so that's good. It means she's getting healthy. I have had the insane urge to nest. Like, I just need to get everything clean and get everything done, and I am getting so anxious that her room is not done. Like, that's another symptom I'm having is I have so much anxiety. I don't know if that's just a hormonal thing or if it's just because I don't feel like I have everything ready, but I have a lot of anxiety just in general. I'm really nervous about the birth because we don't know for sure what the birth is going to be, if it's going to be a C-section, if it's going to be vaginal. We don't know yet, and so I have a lot of anxiety about that. But yeah, I've just been really into nesting, and I need the whole house clean, and I need the dishes always done, and I just always want to be mopping the floors, and I just really, really want to get her room done. The only problem is a lot of the stuff that needs to get moved down into the basement office is really heavy, so I can't lift it, like the computer desk or the file cabinets or stuff like that. I just can't lift it down the stairs, so I have to wait for my fiance, but he's been really busy and working extra so that we can afford stuff since I'm not working, and it just hasn't gotten done yet. So it's not the end of the world if she doesn't get her room done before. I was just hoping it would happen, and because she's going to be sleeping in our room for probably at least 6 months. My son slept in our room until, oh my goodness, how old was he? He had to have been a year and a half. Like, he was getting up there before we moved him out of our room and into his own room. Like, it's just been kind of recently that we've done that. So I also wanted to talk about some funny or embarrassing symptoms that I've dealt with this pregnancy. I think a lot of women deal with the funny or embarrassing symptoms, but I know when I sneeze or I cough, it's like that constant feeling of, oh crap, I just peed a little bit. So I cannot wait for that to go away because it's just very embarrassing. It's like, okay, well, Good thing I don't go out of the house very much because, especially when I'm standing up and I have all that pressure and then I sneeze or I cough and then it's like, well, I peed. I know one time I thought my water was breaking, but it was actually just pee, so we're doing good there. I have had some gas, which is kind of embarrassing depending on where you are. Like if you're out and about and it's like, oh my goodness, my stomach hurts so bad. But I think just the gas pain in general, it can bring on contractions, I think, because then I'll have like gas pain and then I'll start having contractions and it's just, I think gas is normal during pregnancy. The worst is when, after your C-section and you have gas and then it starts traveling up to your arm and into your shoulder, and then you have to take gas pills for that because, oh my goodness, that is so painful. And having really emotional, like embarrassing emotions where my son will cry and then I can't get him to stop crying, so then I'll start crying, and then my fiance's like, oh my goodness, are you crying too? And so then he's crying and I'm crying, and then I'm laughing because I'm crying, and it's just, my emotions are just up and down and up and down. Like it's just really bad. I don't know. Hopefully that will go away. Well, I'm sure it'll happen a little bit postpartum too, because it takes a while for your hormones to settle. But that's really embarrassing because then I'm crying over the stupidest stuff. I swear, because of the C Diff or the GI symptoms I'm having, which I'll go into in a little bit, I am on a very strict diet, and so the other day I just cried and cried and cried because I just wanted tuna salad. I wanted tuna salad and potato chips so bad, and I could not have it because it would make me sick. And I've also been crying because I want ice cream, and I haven't had ice cream in months, and I'm like, I just want an ice cream cone. So it's just really embarrassing because then my fiance looks at me and he's like, oh, okay, are you going to be all right? So that's pretty much all as far as symptoms go. I'm big and I'm uncomfortable and I'm in pain, and then I'm still having like the embarrassing, like the gas and I'm gonna pee when I sneeze, or, that kind of stuff. I saw the GI doctor today. That was really interesting. It was nice to actually be able to talk to somebody who specializes in it instead of just talking to the nurses and like my OB. Don't get me wrong, like I like my OB. She's nice. She knows her stuff as like being an OB, but it's just not her specialty to deal with like gastrointestinal issues, which is fine. So it was just really nice to talk to someone who's had experience, and it felt like he was more confident, whereas my doctor is like, I don't know, like it could be anything. But when I talk to him, he thinks that I just have some damage from the C. diff. He doesn't think that I still have the C. diff, which is really good because I did not want to go on more medication. He thinks that it's possible I still have C. diff, but he does not think I do. He thinks it's more damage, and either he thinks that I might have IBS or Crohn's, which is why I am on a strict diet and just trying to get through the pregnancy, because he told me there's really not much that he can do while I'm pregnant because he wants to do a colonoscopy, he wants to do all that kind of stuff and put me under, and he just did not want to do that while I am pregnant, which I'm totally fine with. I do not want a colonoscopy while pregnant. That does not sound fun. So that's good that I don't have C. diff. He thinks that I'm a carrier for C. diff, so I will always kind of have that in me. And so I'll still need to, bleach the bathroom every so often, or bleach whatever, especially if I'm having symptoms, because he thinks that, I probably picked it up in the 10 years that I worked at the nursing home, and then I'm just a carrier, and then, symptoms could pop up or not pop up. It just kind of depends, especially if he thinks that I have an underlying, like, IBS or Crohn's or something, then I'm more susceptible to the C. diff symptoms showing up. He thinks that I probably have had IBS for a while, and that it's just I ended up getting C. diff, and now I probably just have damage, and so it makes it really hard to eat certain foods. I'm just on a really strict diet. I need to make sure that I'm not eating any cheeses or drinking milk, no lactose. I can't have anything with spices, no like pepper. I can have a little bit of salt, but like really bland food, just really not seasoned. And also, I have to be very careful about fats in my diet. I can have like the hummus and the, avocado and stuff like that. He wants me to try foods, but he said no mayonnaise, no, like, limit your butter, limit that kind of fats, no fried food, no like breaded chicken sandwiches or anything. I just have to stay away from anything that is like fatty or has lactose, and just kind of anything that tastes good. Still no coffee. I can't have coffee or tea or like anything with caffeine in it that will irritate it. Chocolate, no chocolate. No, nothing that's really sweet. No sweets, no candy, no nothing. So that's going to be kind of depressing with Easter coming up. But so then I will just have to make sure that I am eating really healthfully, I guess, and just no fats, no fried foods, no lactose. And he also wants me to start introducing more foods into my diet. He does not like that I was so strict about, like, he knows that I'm, nervous about having symptoms, but he said you need to start introducing foods so that you're getting some kind of nutrition. Because of the blood loss when I use the bathroom, or because of the lack of nutrition that I have in my diet. Like, it's just, I'm pretty much only eating carbs and very small amounts of carbs, and so I'm not getting a whole lot of nutrition. So he just wanted to make sure that everything was okay with my blood. So far I've got one test result back for creatine or something. It was supposed to measure, like, I think it's your liver function or something, to make sure that it's not, to make sure that it's filtering out what it needs to and it's okay. And so far that came out normal, on the very low end of normal, so I don't know if that's good or bad. I haven't really researched that. But I'm just waiting for some more tests to come back to see how my iron is, and just to see more about how my body's functioning. But otherwise, I just basically have to wait until she's born, because there's really nothing they can do right now other than treat the symptoms, and keeping me on a strict diet to help the symptoms pretty much just go away. And then if I still have symptoms after she's born, then I come back, I get the colonoscopy, he sees, what's wrong. So that will be, it was interesting. It was a nice appointment. It lasted about an hour, so it lasted a really long time. But I was really glad to be able to talk to somebody and kind of ease my fears about, like, am I going to have C. diff forever, or what's going to go on. So that was good. But otherwise, that's really all that's gone on this week. It's just kind of been dealing with the pregnancy symptoms and the stomach symptoms, and I'm still huge, and I'm gonna just keep getting bigger. And this weekend, we have our maternity pictures, so that'll be really exciting. I'm excited to have all three of us in the pictures, plus the baby in my belly. So we'll have me, my fiance, my son, and then my daughter, who's in my belly, will be in the pictures. So that's really exciting. We were going to try and take some outdoor pictures, but because of where I live, we're going to get like 6 or 7 inches of snow. So who knows? I don't think we're going to be doing outdoor pictures. I think we'll be doing most of it in her studio, but I'm hoping that maybe it won't be as bad as they say, and we can get a little bit outside, but we'll see what happens. Otherwise, thank you so much for watching. If you enjoyed, please subscribe, and then you'll know when I post my next video. I'd like to talk about next what I have in my kids' Easter baskets, so that will be fun. I have an Easter basket set up for my son, and then just in case she comes a little bit early, I have an Easter basket that we're setting up for her. So if you would like to watch that, subscribe so that you know when I post it. All right, thank you. Bye.